Zambia has in the recent years recorded an increase in the number of street children. This poses a great danger to their health, as most of them do not have access to medical facilities and services. On this week's edition of News In Depth, we focus our attention on the health of a street kid, with much reference to their access to sexual reproductive health and information services. I am your host for this week, Macpherson Mkuka. Stay tuned. They fear being seen by people while they sleep in drainages during the night. So they wake up early in the morning from these drainages and sometimes from uncompleted structures where they hide themselves in the night. They think of what next to do for their living. These children have no one to provide food and any other necessities for them. They rely on handouts from the streets to find a meal. Some have come up with business plans. They opt to lift heavy luggage and groceries on their heads for shoppers who give them money in return. Many are seen asking for alms from motorists, while others lead the blind for a similar venture. This is a common sight in most streets across the country, especially in the capital, Lusaka. These are children who are either orphans or have left various homes to live on the streets. They are a special group of children whom society has termed street kids. The prevalence of street children is a huge problem in Zambia. Current statistics indicate that over 20,000 children work and live on the street in Zambia, with factors such as divorce, poverty, and the HIV and AIDS pandemic, which continues to claim lives, among others, being cited as major causes. But what could be other factors leading to the children going to live on the street? I caught up with some of the street children and they shared their side of the story.
Atati banafa, banafa, ndrama za kuskuru, zende zinasi, lero kunyumba futi ndrama zinasi. Sozo ni pila kuskuru, debena tabela kunyumba, zeli bendrama. De manje pa obura kuno kurusana. Kuno ningara che mtamu.
Unabada banje kuno kurusana?
Nakura na basi.
Basi unakwenda kulipira banje?
Nakwani zoripi. Nakwani zoripi.
Unataka kutendama zoripi ya basi?
Ndofuta mapesi weko.
Skuru kai ni skuru napelea kwa mmoja chunga mna munganiona. Skuru napelea chemu grade 2. Benzo anambu ndo batati pa nenzo anatukira kusota. Grade 2 ndiye penda pili yako skuru. So kubolera na maneno nionekera so.
For those that have been taken off the street, they too have their own tale to tell.
I think it was just a group influence, and my friend told me that in the street you live a life better, no one will bother you there, so that's how I followed her. I went to the street because I was being mistreated where I came from. You do a lot of house chores and not going to school, so that led me to go to the street.
Street na bwana ndamo 2011. Na bwana teba kunyumba kanikonda tia bora, so na bwana amenya bora pa industry ya motoka, so na yo pa kunimia mbona bwana tebera kunyumba.
I used to stay with a woman called Auntie, but she was not my relative. We just used to call her Auntie because she was the one who helped me since the time I was young. That time we lived there from the time I was young to 12 years old. Now that side she used to segregate. She had her own children and us we were only the two of us. We used to stay with her. Then sometimes when you just seated alone, she used to sometimes beat you without any reason. Then sometimes she never used to give us food for us to eat. But when we sat down and thought with my friend that for us to get food, you have to do a very big job for her so that you can get food properly. But sometimes you have to maybe wash all her clothes together with her daughter's clothes for you to eat food. That's how we decided with my friend that look at the way we're living like this. It's better going in the street as if you don't have anyone to look after you. That's how we decided to go in the streets.
To tackle the problem and help protect the children, some non-governmental organizations have decided to put the children under their care. One such organization is Vision of Hope. This organization seeks to reintegrate specifically girls from the street with their families.
We want to facilitate the transitioning from the street into a facility, a safe home where they can have access to this information. They can't read. Much of them can't read, they can't write. They are not in school. They don't have access to media like this, access to TV, access to newspaper or magazines and all this where they can just basically access information. So much of the information that they have is what they hear, what they are told. But one question is, how proactive is this information? Do they put it to good use? Can they remember? Because much of the time on the street, they're high on drugs. They are dirty. They are hungry. They are tired. They need rest. They have their own way of doing things whilst on the street. So you need to be strategic when you are with them on the street. And hence, this is why we have a facility. They know Vision of Hope.
Another organization is Fountain of Hope. This organization has been in existence since 1996. It has a deliberate program targeting the street boy child.
Different children go to the street for different reasons. It could be abuse from home, and then also just even psychological factors, even economical factors that have raised and increased the numbers of children that are going on the street. So depending on the challenges and the case or the reasons, the push factors that have caused this child to go on the street, we have tailored our programs to handle the same situations. And for example, so we do have counseling sessions with them, and then we have focus group discussions with them. We also have mentoring sessions with them, even drama, sports, just to try and help them be able to leave the street and engage in other programs that would help them.
Street kids, like any other persons in need, face a number of challenges. The hardships vary from one individual street kid to the other depending on their age, location and sex.
Para tuma survive assim, tuma pempa tá para passa com sua beta pica, mungana drama, tudo na ndio. Pena na bread. Diago só. Para onde doara, ufa. Só na pessoa assim.
Life was very difficult because for you again to eat food, it was also difficult, but we had a free mind. We never had someone to shout at us. For you to ask food, you just go on the streets, you beg for food there. Then if someone wants to give you food, they will give you. But sometimes if they want to give you money, they will give you money, then you just go and buy food on your own.
Mu street muno simwa munche mwetu gona muno. Wanu muli matenda osiyana, wanu muli kumenyana, muli kupayana, muli kulasana ma screwdriver.
Life in the street, it was very hard because they just do crazy things, like no one will bother you. Like doing things that you're just yourself, no one can control you.
These boys are former street kids. They shared with me some of their many challenges they faced while on the street.
Bigger boys, na vena ngocheba fana ndeni kwanza ngarati mukukafipa so kumazo tapeza akuza nati iwanifuna mano kabwana chasona chanaso denga sabwana cheve azakumenya kuja so ufunika making sure ngani ku bache wabachija wamletera mangarati zapeza ati aenda koleka mkazi bamkani mmet bacha mkagona usundabacha akukira nenanzokana penanzokana pacha kaya swama nkaracha teka chari moja memba makara babili wala batatu beza wenda nguza cha za kumenyero bajwa kuroma ndana manaifu so sunga kana
kule mkazi anaanza funa vakujibana anaanza tenza kupaza vakujanza nipaze ni bwati gonana tunagonana tupata gonana after tasiriza bwani pasava kodi nazafuna chene ngazinkara nonimenya manje pa street apo naenda penseli njara so aliko soma mona mozi amba onzati kapena funa vokudenza pas 5 kwacha bwana kuchite gumbo mpena bwana vomera.
Despite the many challenges which the street kids face, perhaps the most pressing issue is the lack of access to health facilities. Health services, such as access to sexual reproductive health information, which include access to condoms and contraceptives, seem to have been eluded from these street kids. Many of these children on the streets are alleged to be actively engaged in unprotected sex with either their peers or elderly strangers who take advantage of their vulnerability.
I was sexually active because for me to get a bed space, you have to like talk to the guys who are responsible for that. Then when they want to give you a bed space, they will tell you that if you want me to give you a bed space, I have to have sex with you. Then you can't refuse because you look at the surrounding, it looks clean. Sometimes you just get like sacks of mealy meal, then you spread, then you sleep. Then if you want them to give you a proper blanket to cover, you have to do the same thing so that they should give you nice sleep. I've been doing that for almost 4 years, just sleeping with different men. Some of them were big people, like if they want to give you something, they wouldn't give it for free until you have sex with them. That's when they'll give you.
But when I'm going to wakazi wakati banapanga chati mangani ka nyumba chepe paja nafaka chetu masakati banakwatirana che manjene nazebe nazonkara che kuli ma guys bakuru so ndikunazo kuona. But when I'm wanzona sipangira chetu manyumba ndikunazonkara.
In order to overcome the problems, both Vision of Hope and Fountain of Hope devised outreach programs aimed at reaching out to the street kids.
Do street outreach. When a child is kicked out of the family, out of the community, it could be any form of abuse that could come. A child is already on the street. That's a child on the street. Okay? Now they become managers of their own lives. So in terms of what they want to hear, in terms of what they want to do, is about the environment, the situation, the time that they are found in. So these are things that, with the children living on the street. I can give you one particular example. One girl says, I have 7 sexual partners a day. Why? She needs to buy what is called Bostik. Bostik is just a street name of, what they are sniffing on the street. Okay? She needs to bath. She needs a safe place in the night. So somebody has to take care of that. She needs somebody to provide a meal during the day. She needs money to use the toilet, sometimes even to take a shower. Now, for all these things to happen around, and most of these girls are in their adolescence stage. So when you talk about puberty and adolescence, it also comes with its own crisis. It comes with its own issues. So when you talk of reproductive health, sexual transmitted diseases, this is something else. It's at its peak, including HIV/AIDS. Information dissemination. How much do they know about HIV and AIDS? What about adherence? All these are issues that we try and speak to them in a language that they use. Because when we're dealing with them, we don't use this kind of communication.
For us as Fountain of Hope, being an organization that has been working with children like for the last 19 or 20 years, we have developed programs that are child-friendly. Yes, because we do our street outreach, of course, as an outreach team, going to the street to talk to the children, and then we also counsel them on the challenges that they face. So one of the things that we have done as an outreach team is to try and develop programs that would help the children access information about sexual-related diseases, for example. And so when we do our street outreach, we talk to the children about the different mechanisms they can use also to protect themselves from accessing or maybe contracting diseases such as HIV and AIDS. So we do have, like I said, focus group discussions, and in these discussions, through our even clinic that we have, we engage children at that level to talk to them about sexually transmitted diseases and different sexual-related issues.
BBC Media Action Zambia has in the last 3 years been conducting a radio-based informative program aimed at giving young people a platform to make informed decisions on sexual reproductive health. This is being done through a program called Tikambe. But has the program managed to reach out to the kids on the streets?
That's an interesting aspect, actually. We have both media and interpersonal communication. And, you know, it's a little bit difficult to reach the street kids or the kids on the streets, if you consider TV or radio. But there's this aspect of interpersonal communication that can be used to ensure that you reach out to them on one-on-one basis. You know, that's why we call it interpersonal communication, so that we give them the information that they need. I'm sure some of these young people are in different places that, you know, maybe establishments like in different homes. You can actually reach out to them in that manner. Or you can actually come up with a deliberate move to ensure that at some point you reach out to them and you give them this information. There's a lot of information that they need. Others, they not know exactly how certain diseases come about. It may help them to give them information on how to maybe just use protection, use condoms.
On several occasions, these street children engage in violent behavior when approached by strangers. The violent behavior is, however, attributed to some street kids allegedly being under the influence of drugs.
Actually, it's a risky thing most times, but we as outreach officers interact with these children at their level. We go down to their level because we know that the kind of children they are. So we interact with them at their level. So that's how we find it a little bit easy. Although their lack of knowledge is actually very high as compared to what they know and the things that they do. Their lack of knowledge on such vices is actually very high.
We have built a relationship with children on the street. Most people think street kids are thieves. I can get to the street. I can give my phone to a child and I'll concentrate talking to the other child. Treat them the way they are. They are just children. They need your love. They need the support. When you get to their level of accepting them, they will accept you. But the issue is we are too smart for them.
Some former street kids have admitted having been in touch with the two organizations.
The only organization that I saw coming was Fountain of Hope, together with the Vision of Hope team. They used to say that you should always remember that when you are in the streets, condoms are very safe for you and for your health. There is HIV, and you can get some STIs called. They told us about certain diseases that you can prevent before having sex.
Wenza bwapa every Friday so wenza bwera tuzako ati oro mukazi oro mfano mukuru funikisa wazinya condom suzu avamine bana mchita plani bakuru ni wafana.
It was in 2012 we had the meeting with Vision of Hope. They used to give us the information how to use condoms and how to faithful to one another, how to stick to one partner. Yes, we are once taught. Several times.
Pregnancy and sometimes death of a street kid after an illness from an infectious disease is part of life for a street kid. One of the former street kids shares how she witnessed a friend giving birth whilst on the street and another dying due to an illness.
During my time on the streets again, there were girls who used to get pregnant, then some used to give birth on the streets. You find we're just seated like this, you find someone is pregnant. Then that time we were seated, it was around 17. We were seated, then we just heard someone crying. So when we rushed to go and check her up, then we found she was giving birth. Then we went to call a certain lady who sells stuffs there at the road there. Then that's how she helped her give birth. Then some of them, they used to develop sores at their private parts. Okay, some of them even used to die. There was a time that we went to bury a friend from the street.
To overcome these challenges, Vision of Hope has set up a hotline which is used by members of the public to alert the organization in cases where a street kid is seen to be giving birth on the street. The organization has also engaged foot officers who are on the lookout for sick-looking street kids and those that are pregnant.
When it comes to children directly on the street, we have a network. So even when there's a danger, a child is bashed on the street. A child is very sick on the street. We are not on the street, it could be in the night. They have our phone numbers. We've also strategically partnered with institutions around where these children are operating from. For example, Soweto. We have a few contacts of where the children will go to sleep in the depots. They call them depots anyway. And we have strategic people that we are very much on the ground within Soweto. So sometimes they'll just pick a call, okay, there's a situation here. If we are not directly on site, Footprint is directly on all the time on the street. Their job is to link these children and we communicate.
Tikambe project manager Emmanuel Mlenga says there is need for a holistic approach that will deliberately reach out to street kids.
Sometimes we design programs in bits where you just target a certain audience or a certain group, and then you leave out the other group. At the end of the day, you may score successes in this area, but the other area you find that you have not actually achieved. That is where the problem is. But there is need to ensure that all different stakeholders are actually brought together and you have a sustained program or a deliberate program that actually reaches out to all the different players. The aspect you brought in of the young people on the streets is actually an interesting one, and most of the times these young people are actually left out.
And both Vision of Hope and Fountain of Hope have an appeal to make to all stakeholders to fight for the plight of street kids and their right to access to sexual information.
My appeal to the government and different stakeholders is coming together towards a common goal. If we are going to work with street children without the knowledge, we are not going to attain anything. You cannot work with a street child when you don't know the exit strategies on the street. So let's work together. Let's put our efforts together, and definitely we can do it.
For me, we appreciate the current review that has been held. For example, they are trying to, as much as possible, we do engage with social welfare at a certain level to try and help these children. But maybe also if they could empower drop-in centers like Fountain of Hope with the resources that could help them disseminate this information to these children, it would be of great help.
But the BBC Media Action Zambia feels what really needs to be done is to design programs that will not only focus on the young people in schools, but also the ones on the street.
With all these interventions in place, that we came up with something that will respond to the needs of the young people that are suffering on the streets, especially when it comes to sexual and reproductive health. When we talk about comprehensive sexual education, it's a critical issue. Very, very critical issue that should be taken seriously, and making sure that in terms of planning, all the kids, because they've got the same rights, they're actually included. But when we look at all these things, we would like to just make sure that these things reach out to every young person in this country, regardless of their status.
And having left the streets, some of the former street kids look forward to being reintegrated with their families and even in school.
Life for me it's now better because I'm even about to go back to school. I wrote my grade 9 last year, then I passed, then I'm now doing grade 10.
Apana buache pano pena ambira na school. Nambira school pano grade 2 hapa nindine grade 6. Nilemba next year. Nimaenda tukavera ma school kunyuma. And sometimes per flight then maenda na hapa Sunday.
But for those that are still on the street, all they need is empowerment to start a business, while others are willing to be taken to ZNS for training in various skills.
Ningafuna ni master che mutu mito sapa. Ni skulu che. Kunzi, askari ni skulu ni narekira mu grade 6. Gara mu 2005 ndipenda nika skulu.
Tufuna government batitandizeko ise. Batsakireko kwa kuti kuja konkala or very kuzedenyeso kutaenda tachago tuma skills kuti naise kusogoro ya time tuna setikatanze ko ambu yatu etina sana bevi na fana banga ba Wednesday nanga batyaonga batokopita batyaonga basi bataonga nwa kutweve badreti bakubea viti bezo emirira pano.
Supporting efforts to realize the rights and development of street kids in Zambia presents a significant and multi-sectoral challenge. Strategies for education, sexual reproductive health, water and sanitation, and child protection are vital to address the challenges posed by broken extended families, poverty, and the HIV and AIDS pandemic. This is where we come to the end of this week's edition of News in Depth. We have been looking at the health of street kids with much reference to their access to sexual reproductive health information and services. I have been your host, Macpherson Mkuka. Be sure to join us next week for yet another exciting News in Depth program. For now, it's goodbye and enjoy watching ZNBC.